Hello. So this slideshow or this video is going to cover the very last section of lesson 0. So we'll be covering, if you're following along in your packet, pages 13 and 14. So let's start with page 13, which is all about sexual health concerns of teens. So think about it. What are some things related to sexual health that teens might be concerned about? Doesn't necessarily mean it's a problem. It's maybe just something on your mind, something you're wondering about, changes going on in your body. It could be an issue, a problem, a health concern, but it could just be, I don't know, what is this? Is this normal or not? So let's start with the female. So some common health concerns for females are, first, STIs, sexually transmitted infections, or STDs, sexually transmitted diseases. We will, later in this unit, we will cover the most common STDs and the treatment and, of course, talk about prevention. We'll be covering that as well, but we'll learn about symptoms from STDs as well. All right, cervical cancer is next. Cervical cancer is abnormal cancerous growth in the cervix. There is a link between the virus HPV, human papillomavirus, and cervical cancer. A lot of teens are actually vaccinated against HPV. So I'm not sure if you are or not, but you can talk to your healthcare provider about that. Next is a urinary tract infection. So a urinary tract infection is a very general term to describe any infection related to the urinary system. Men can get urinary tract infections too, but they're more common in women. And it's often an infection in the urethra. It could also be in the bladder or somewhere else in the urinary system. It might cause a lot of burning, pain, especially when urinating. Another concern could be a vaginal yeast infection. Again, this is kind of a general term. You would want to get diagnosed by your doctor to see specifically what kind of infection you have. It's typically a candida yeast infection that is easily treated, as with a urinary tract infection, easily treated. Menstrual problems, again, this could be a lot of things. It could be severe cramps, it could be missed periods, it could be heavy periods, long periods. So sometimes things happen and you're just not sure, is this normal or not? And then the physical appearance and development of sex organs, that's a concern for a lot of people, including teens, adults as well. But especially as we go through puberty and we're noticing these changes in our body, we might be concerned that things are developing properly, normally. Is this normal, healthy, or not? And then endometriosis is on the list, the last one. Endometriosis is, remember, the endometrium, the lining of the uterus. Well, it starts to grow outside of the uterus. So it might be in the fallopian tubes. It might be on the ovaries. It can be treated. It can also be very painful. So that's a concern that some women have to experience. Another concern, not on your list anywhere, but how about breast cancer? So a lot of women are concerned with that. Men can develop breast cancer as well, though. It's just much more common in females. And then pregnancy. I mean, that's a concern, especially when when a person decides to become sexually active. That is certainly a concern to think about. All right, let's move on to the male. Sexually transmitted infections is on the male list as well. As I mentioned, we will cover these later in the class. Many STIs can be treated and cured. Some cannot. Like I said, we'll cover that. Nocturnal emissions or wet dreams, which is when a male ejaculates in the sleep. Completely normal, whether it happens or not, whether it happens a lot or very seldom. It's all usually normal. Physical appearance and development of sex organs, just like with the female, as you're going through puberty and your body's changing, a lot of us become more concerned about what's happening with our body. Prostate cancer. So the prostate gland is one of the glands that contributes some of the fluid that makes up semen. So prostate cancer is just cancerous cells in the prostate. If it's detected early, like most cancers, it can be treated successfully. When men reach a certain age, I want to say it's around 50, having a prostate exam is a routine exam. A male might experience pain when he urinates or having trouble urinating. That's one of the key signs of prostate cancer. And then testicular cancer would be obviously cancerous cells growing in the testicles. Testicular cancer is actually most common between the ages of 15 and 35. So one thing that we will talk about is testicular self-exams, just like we'll talk about breast self-exams. Typically, when a male has testicular cancer, it only affects one testicle. So that one testicle can be treated and usually removed. And it does not affect the sexual health of the male because the other testicle can produce all of the hormones and sperm that a male needs to have good reproductive health. The only other example I had on my list for males was breast cancer. I mentioned earlier that males can develop breast cancer as well as females. It's just much more common in females. All right, let's move on to page 14. So on page 14 in your packet, you have 3 big circles. In the middle, actually you have 4. So in the middle, you have maintaining reproductive health. That's what this whole section is about. Above it, it says annual checkups. So I'd like you to kind of draw a line from maintaining reproductive health to annual checkups. And then draw a line from maintaining reproductive health to self-monitoring. And then draw a line from that center, maintaining reproductive health, to community resources. And then we're going to, off of those other bubbles, we're going to fill in, we're going to write some things around there, okay? I'll show you mine real quick. It kind of looks like a, I don't know, spider web. If you can see this real tiny. Do you see how I have my center bubble? And then I have lines going to those other 3 bubbles. And then off of those, I have the items that we're going to look at specifically. All right. So let's start with annual checkups. So a lot of people will schedule an annual checkup, a yearly checkup with the doctor. And this is where you just check in with your doctor, get some things monitored. This might be where your doctor notices a health concern that might need to be treated. How about your height and weight? Every time you go to the doctor, when you're growing, you probably have your height and weight measured. Heart and lungs as well. Your doctor will put the stethoscope on your chest, on your back, listen to your heart, listen to your breathing. Okay, so as he's doing these things, or she, as the doctor's doing these things, checking your height and weight, even your heart and lungs, the doctor's just monitoring. Is everything healthy? Are you developing as you should? This might be a point where a doctor would pick up on something that isn't quite right. How about your family history? So this is where your doctor might ask you questions about your parents and your grandparents, siblings, to see if there's any health concerns that might run in your family. Drug use. Be honest with your doctors about drug use. They're not here to get you in trouble. They're here to help you. So if you are using drugs, for example, smokeless tobacco. I mentioned this when we covered smokeless tobacco. I said, be open with your dentist about this because your dentist can maybe notice sores in your mouth. Well, depending on what drug you're using, you might be increasing your risk of some other health issues. So be open with your doctor so we can pick up on any other problems that might be occurring in your body. And then immunizations, those are your shots, your vaccines. Your doctor will probably look over your immunization record and see if everything is up to date, possibly recommend some immunizations for you. And then the last one is your sexual health. The doctor might ask you questions. There might be a physical exam of your reproductive organs to make sure everything is developing properly. All right, so those are things that your doctor is probably going to pick up on. But how about you? What are some things that you can pay attention to? You can monitor yourself. All right. I don't know about you, but every time I get a cold or a sniffle or cut myself or, have a sore back or something, I don't run to the doctor. I monitor it myself. I take note of my symptoms And if things aren't getting better, I might do some of my own research, try to treat myself. But if it's not getting better, that's when I might want to go on to see somebody who knows more about this topic than myself. But it starts with me monitoring. And then when I do maybe go to the doctor, I can say, well, this started, 3 days ago. These are my symptoms. This is what I felt. But start with yourself. Monitor yourself. Lingering pain, fever, fatigue. Again, those would be things to monitor yourself. How high has your temperature been? How many days has this been going on? Breast and testicular self-exams. So these are 2 exams that you can do yourself. We will probably talk more about this in class, but both of those are exams that you would do to yourself to feel for abnormalities, maybe lumps, bumps, change in shape, change in size. And then if you do notice something, again, you would probably call your doctor to get a more thorough exam. How about your mental and emotional health? This is a really big concern right now. Check in with yourself. How are you doing? Are you doing things to take care of yourself emotionally and mentally? And if things aren't going well, I've said this many times, if what you're doing isn't working, seek the help of a professional. Painful urination. It could be the sign of nothing big at all, easily treated, like yeast infection, urinary tract infection. It could be the sign of something more serious, but you're not the doctor. So go monitor it yourself and then have a doctor check it out. All right, and then it says abnormal discharge and odor. So abnormal discharge and odor must mean that there's normal discharge and odor, and there is. So if you notice something that seems unusual, looks unusual, smells unusual, you notice this yourself, right? Self-monitoring, then you have information to take on to a professional. All right, community resources would be, the experts, people who probably know more about these topics than you do. So if you are self-monitoring and you have a more serious concern, who could you talk to? How about your family physician? So your doctor, your nurse practitioner, whoever it is that you go to, that would be a great place. Some people might choose to go to a public health clinic or a teen clinic. You might call a hotline number. And if you call a hotline number, you can, give them as much information as you can, like symptoms and how long these have been happening and what you have been trying to do to treat yourself and whether that's working or not. And then support groups. So maybe you have been diagnosed with a condition. You could go to a support group where everybody else in that group meeting is also dealing with the same issue that you have or you're struggling with. So you can support one another. All right, so that picture is supposed to be going to your family physician, some sort of a health clinic, calling a hotline number, and then going to a support group. A support group could also just be a group of people that are supportive for you. All right, on this slide, there's just a whole list of web-based resources for you. So I'm just going to click through them all. There's no assignment or anything tied to this. It's merely resources. Reproductive health services for teens. So you can always talk to your doctor. You can go to this Family Pact website, or you can text the word clinic and your zip code to this phone number, and you will get the closest clinics nearby your zip code. It's going to show up on your phone, so I'm just warning you there. You can get the same information from the Family Pact website. And again, more information for you. In California, minors of any age can access free and confidential health services without a parent consent, including pregnancy, contraception, which is birth control, and abortion-related services. Minors 12 and older can access STI testing and treatment without a parent consent. Now, I'm telling you this because this is the law. However, I'm also encouraging you very strongly that if you need to go seek out these services, I really encourage you to have a trusted adult with you. These are big topics, possibly life-changing issues and decisions. And the thought of you, I have teenage kids myself. The thought of one of my own kids going to a health clinic, for example, on their own is just heartbreaking to me. I hope that you do have a trusted adult. If my daughters came to me and said, "Hey, I'm worried I might have an STI," I might be disappointed, yes, but I would rather be there and be there for them, go with them, rather than them doing that on their own. That's what breaks my heart. So, although that is the law, if you have a trusted adult, please get that trusted adult involved. But it is the law because not everybody has a trusted adult. And so for some people, getting an adult involved might have pretty severe consequences, negative consequences for them. So please, I encourage you to have a trusted adult if possible. All right, this is the wrap up for this lesson. So these are true, false statements. What do you think? True or false? Sexual orientation and gender identity mean the same thing. That is false. Number 2, as their bodies grow, teens may become concerned with body size and shape. True or false? That is true. Number 3, maintaining reproductive health includes getting checkups, monitoring your own body symptoms, and seeking accurate health information. And that is true. Number 4, our group agreements for class include respecting others and maintaining confidentiality. And that is true. All right, there's a couple of other wrap-up slides here. This one is a partner assignment. We're not going to do this, but it's something to think about, maybe a good topic for discussion with a parent or trusted adult. It says, turn to a partner to check your answers and tell him or her the most important or interesting thing you learned during this lesson. How positive are you that you can protect and maintain your reproductive health? And if you feel comfortable, ask a parent or guardian or trusted adult to review your completed lesson worksheets and tell you at what age they started seeing changes in their bodies and what type of health issues run in their family. That way you have an idea about your own family health history. All right, and that wraps up this lesson. If you have any questions, please email your teacher. Take care.